Tonight we have four outstanding speakers who are experts on the evaluation and treatment of shoulder fractures. Our first author, Dr. Milton Little, is a member of the Orthopedic Trauma Service at Cedars-Sinai Medical Center in Los Angeles and is also a member of the AO teaching faculty. He'll present his paper, The Impact of Three-Dimensional CT Imaging on Intra-Observer and Inter-Observer Reliability of Proximal Humerus Fracture Classifications and Treatment Recommendations. The second JBJS article, entitled Hemiarthroplasty versus Reverse Shoulder Arthroplasty for the Treatment of Comminuted Proximal Humerus Fractures in Elderly Patients, will be presented by Dr. Derek Cuff. Dr. Cuff is an orthopedic surgeon at Suncoast Orthopedic Surgery and Sports Medicine in Florida, where he specializes in minimally invasive arthroscopic procedures as well as complex shoulder and elbow reconstruction. Dr. Cuff is also a member of the American Shoulder and Elbow Surgeons. Each author presentation will be followed by a commentary. Dr. Little's paper will be commented on by Dr. Michael Gardner, who is professor and vice chair and chief of orthopedic trauma at Stanford University School of Medicine. Dr. Cuff's presentation will be discussed by Dr. J. Michael Wider, who is a professor of orthopedic surgery at Oakland University William Beaumont School of Medicine and also vice chair and chief of shoulder surgery at Beaumont Health System. We will save the last 15 minutes for questions from the audience. The questions can be sent in at any point during the presentation. Dr. Swintowski will help me identify the most relevant questions, and I will direct them to one or all the speakers. Now let's begin with Milton Little.
Good evening, everyone. I'd like to thank you for the opportunity to participate in this webinar. I'd also like to send a special thank you to my co-contributors, Dr. Dean G. Lorich, who is the PI for the project at HSS when we completed it. An additional thank you to Major Marshall Burks, who is currently serving our armed forces for the U.S. Air Force abroad. So we'll talk about our study from HSS from evaluating the impact of 3D CT scan on intra and inter-observer reliability of proximal humerus fracture classification and treatment recommendations. As Dr. Swintowski mentioned, effective treatment begins with appropriate classification of the injuries. The classification system should be both reproducible and it should direct care. And many questions about the current classification systems for proximal humerus fractures are debated, and despite its constant use. The Neer classification was originally described in 1970 after an evaluation of Dr. Neer's large series of proximal humerus fractures. The reproducibility and agreement of that classification system has been poor to moderate through many studies which have been performed when evaluating it with the use of radiographs, which have had kappa coefficients as about 0.27. The use of 2D CT scans, which showed a slight improvement of that. Additionally, the use of AO and the OTA classification has been performed, and multiple studies have looked at its efficiency or efficacy at and reproducibility, and it's been shown to be pretty poor for surgeons. We looked at the global evaluation that a 3D CT reconstruction provides, and we wanted to determine whether that would improve our ability to classify and evaluate these injuries. Here's the Neer and AO classifications. Simple cartoons which provide a little bit of information to help you in terms of thinking about the two injuries. And the big factors for the AO-OTA classification are whether it's a extra-articular injury for an A-type injury, extra-articular type injury with multiple facets, including a tuberosity or a shaft component, and then lastly an articular type injuries. And then as we know, the Neer classification is generally thought of in terms of the 4 parts. So, as I stated before, our goal of the study was to examine the impact of 3D CT imaging on the ability to use those two classification systems to determine the classification of a proximal humerus fracture, as well as provide recommendations for it. We hypothesized that the 3D CT scan would be far more efficacious and far more reproducible than 2D CT scan or even radiographs when looking at the Neer and the AO and OTA classification. All imaging was evaluated by a number of surgeons. There were 2 junior residents, 2 senior residents, 2 fellowship-trained soldier surgeons, and 2 fellowship-trained orthopedic traumatologists. There were 40 proximal humerus fractures, which were evaluated from a previous surgical log of a surgeon. And images were evaluated blinded and in isolation. So 40 radiographs, 40 2D images, and 3D images were all evaluated and then